Welcome to the 700 Club. I'll start this program with the words of Jesus. Fear not, for I am with you. Fear not, for I am with you. Be not dismayed, because the news we've got today is enough to make everybody terrified. 1,000 deaths in a single day, and the worst is yet to come. President Trump is warning the nation that horrific days lie ahead, including an economic impact that could be catastrophic. Whew, not my words. What does the new evidence show about the spread of the coronavirus? CBN's Jenna Browder reports from Washington.
With now more than 216,000 cases and over 5,100 deaths, President Trump says the worst is probably still ahead.
Difficult days are ahead for our nation. We're going to have a couple of weeks starting pretty much now, but especially a few days from now, that are going to be horrific.
And unfortunately, more bad news. The federal government has nearly depleted its emergency stockpile of protective medical supplies like masks, gowns, and gloves.
It is because we're sending it directly to hospitals. We don't want it to come to the stockpile because then we have to take it.
Florida, Georgia, and Mississippi have joined at least 42 other states ordering residents to stay home. But the president is not yet ready to issue similar nationwide restrictions.
There are some states that don't have much of a problem.
There were more than 1,000 coronavirus deaths in a single day Wednesday, more than double that of the flu. The city of Los Angeles is now recommending citizens wear masks in public. New York City's death toll is past 1,300 and climbing as the peak is still weeks away. A video tour of New York's Mount Sinai Queens Hospital showed the hallways lined with new patients.
All these patients here sitting out in the hallways because we are full.
Vice President Mike Pence says he expects the worst of the pandemic will be over by Memorial Day, still almost 2 months away. On the economic front, a huge jump in new unemployment claims is expected to be announced today. More than 285 million Americans live in states where stay-at-home orders are in place. Officials say even with social distancing guidelines in place, up to 250,000 Americans could die from the pandemic, but stress that those numbers can come down the more people comply with orders to stay inside and limit contact. Dr. Anthony Fauci was asked how long social distancing could last.
When it goes down to essentially no new cases, no deaths at a period of time.
And more evidence is emerging that coronavirus infections are being spread by people who have no clear symptoms. The CDC now says anyone exposed to the disease may be a carrier, whether that person has symptoms or not.
So we just need to pretend like everybody has it. That's the best thing to do. So keep that 6-foot distance.
Doctors say it takes an average of 5 days from point of being infected to when they start showing symptoms. But some people never have symptoms. In Washington, Jenna Browder, CBN News.
What Jenna is saying is why I believe I agree with the health minister of China, who said everybody should wear a mask. Everybody, just breathing. You don't have to cough. All you have to do is breathe. And you may be a carrier and you don't know it. I think it should be mandatory that every human being in the United States wears a mask. You don't have to have one of those fancy jobs, but all you need is a cloth covering. But it's not to keep you from getting it. It's to keep you from giving it to somebody else and spreading it all over the country. So I don't know why the CDC is waiting to put that in effect, but it needs to be done immediately. Well, a staggering new number of jobless claims today. 6.6 million new claims in one day. That's double the previous record set just last week. And ladies and gentlemen, I want to tell you, it looks for all the world like the cure is worse than the disease. What's happening to our economy is just absolutely staggering. But think of that, 6.6 million unemployment claims in 1 week. Well, in other news, the U.S. Navy is taking action to prevent an epidemic on one of its carriers. Ephraim Graham has that.
Pat, the U.S. Navy says it's taking nearly 3,000 sailors off the USS Roosevelt to protect them from the coronavirus. Fewer than 100 of the 5,000 service members assigned to the aircraft carrier tested positive for the virus. The captain issued a letter earlier this week asking the Navy to evacuate personnel for their safety. The ship is docked in Guam. The Navy says it's leaving some crew on board to monitor the nuclear reactor and to guard the weapons. A growing number of states have banned elective surgeries in order to focus on all resources fighting the COVID-19 virus. But some argue women should still be able to get an abortion. They say it's, quote, an essential procedure. That has some states fighting it out in the courts. Here's Paul Strand with more.
An interesting side effect of this pandemic is what it's done to the war over abortion. The president's task force has asked states to ban elective surgeries for now. And that's to help deal with the sudden emergency shortage of personal protective equipment, so necessary to guard the lives of those fighting this virus. But some abortion providers have been unwilling to go along, and that's led some states to ban abortion itself. And on the flip side, other states to specifically say it's essential.
The topic came up at one of the task force briefings.
Do you agree with states who are placing coronavirus victims above elective abortions, and should more states be doing the same?
Well, I think what we're doing is we're trying to, as a group, governors, and that's Republicans and Democrats, we're just working together to solve this problem. That's been what you're mentioning has been going on for a long time, and it's a sad event, a lot of sad events in this country.
New Jersey, Massachusetts, Virginia, and Washington state governors have all decreed abortion is an essential need, exempting it from any ban.
We know that abortion is essential health care. It is a procedure where time is of the essence.
Pro-life advocate Mallory Quigley questions the decision and points to the politics of abortion.
They've just put such an emphasis on the taking of an unborn human life, and I think it speaks to the stranglehold that the pro-abortion lobby has on so many in our nation's governments across the country.
But Texas, Ohio, Mississippi, Maryland, and Louisiana are insisting abortion stop in their states, so clinics' medical gear could instead go to fighting the pandemic. But that has led to a reaction of outrage. One activist tweeted, "Needing an abortion is time-sensitive and very essential to a person who needs one." Pro-life bioethicist Charles Camosi tells CBN News he's been watching this all unfold.
Even people who are going to die without a transplant, like a liver transplant, those liver transplants are being put on hold because they're not considered essential surgeries. How in anybody's right mind elective abortion could be in a different category? This beggars belief.
Some abortion clinic supporters go as far as to suggest this is all a plot. One saying the anti-abortion movement is using a public health crisis to essentially ban abortion. Another tweeted, even in a national crisis, they don't stop their relentless assaults on women and pregnant people.
I think that this is just classic abortion lobby anger and fear lashing out at those who want to protect life.
What's still to be seen is how far a state's actually willing to go to stop abortions, where providers have been unwilling to comply with the ban. Paul Strand, CBN News, Washington.
It's shocking to me to think that abortion is considered an essential proceeding and will take the necessary hospital space, nurses, doctors, masks, and all the other equipment needed, and yet they'll defer a liver transplant, which may be necessary to keep somebody alive. You told me that you might not be able to go to your dentist, but you could get an abortion.
Yeah, well, right now, I think most offices, unless it's an emergency, are closed. But at the time that we were talking about that, anybody who wanted to could walk in and get an abortion. It's odd because the very thing they're claiming about this is exactly what they're doing. You know, they're saying we are special, we deserve something over and above. Abortion is a choice. You know, that's what they use, that word, choice. Yeah. So that kind of negates the essential.
It's shocking to me that would go ahead of a life-changing liver transplant that was needed to keep somebody from dying. Yeah, right. And yet here in Virginia, I'm a resident. I was born in the state. I'm so ashamed of what goes on in Richmond. In Richmond, the governor, who himself was, I think, a pediatrician, graduate of Eastern Virginia Medical School, wants to put down and say abortion is an essential procedure. You've got to put it at the head of the line. Shocking, Ephraim.
Pat, more than 1 million N95 masks are coming to the U.S. from China today, courtesy of the NFL's New England Patriots. Workers loaded the boxes onto a team plane at Shenzhen Airport. and it left in the early hours this morning, headed for Boston's Logan Airport. Massachusetts Governor Charlie Baker struck a deal with China for the masks 2 weeks ago, but needed a way to get them here. Jonathan Kraft, who is president of the Patriots and chairman of the board for Massachusetts General Hospital, told the governor he had something that just might help, that great big plane. As we enter some dark days, we're reminded there are stories of hope and survival, like the 90-year-old grandmother who contracted COVID-19 in that Washington State nursing home and now testifies God gave her the strength to beat the virus. Caitlin Burke brings us a story.
This suburban nursing home in Kirkland, Washington, made headlines as the center of the country's first deadly outbreak of COVID-19. Since the first positive test at the Life Care Center on February 28th, the virus spread to nearly 2/3 of its population. Geneva Wood spent much of the winter there, recovering from a stroke. Just days before she was supposed to go home, COVID-19 put the facility on lockdown. 3 days later, Wood spiked a fever.
I didn't know that I had the virus until I had the virus. I had no symptoms of it before.
While other news outlets have talked about the 90-year-old's love for her family, spunky spirit, and the amazing fight she put up, Wood says it's her faith that is the most important part of this story.
Hadn't it been my faith in God and my family and their prayers and all of their families and the church and everything, and just the faith and prayers pull me through.
Largely kept in isolation, Wood says God was her only companion. She specifically remembers one night when she wasn't sure if she would survive until morning.
I could feel God's presence. His hands were on my body, and I could feel his presence that I wake up and I could feel these hands. And I went back to sleep. And through the night, as I wake up, I couldn't see his face, but I could feel his hands. And I knew he was with me. And I made it through the night until you felt the God's presence and his hands on you. It's something else. And if it hadn't have been for him, I couldn't have done it. And I wasn't alone because he was with me all the time.
Wood also remembers one special doctor. He brought her a Bible and spent time each day reading her favorite scriptures.
At first off, I said Psalms 23, but he would read to me every morning.
Wood's family calls her recovery miraculous. 19 days after entering the hospital, she was sent home, coronavirus-free. Now she has some advice for everyone else battling the virus.
Don't give up hope. God is always there. And put your trust in him and lean on him and give your life to him, and you'll make it. But you've got to not give up hope and fight.
Caitlin Burke, CBN News.
Put your trust in him and do not give up hope. Pat?
I want to repeat that scripture that I started the program with. It's Isaiah 41:10. Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. Yes, I will help you. I will uphold you with my righteous right hand. Fear not, for I am with you. I know there's a lot of fear in the world. Don't be afraid. We have that dear lady out in the state of Washington recovering from that stuff because God touched her.